decision, whether it's any government. And I think this is where really having close discussions between the scientists who are generating the evidence as well as the political leadership through the diplomatic community, this is a way of doing it. And I think with us as Tanzania, we were able to navigate some of these tensions during the COVID pandemic because we're able to generate and write commentaries, generate evidence from Tanzania, and this is informing now whether it was political decisions that were made or it's what we learned from that discussion. So I think as scientists, we don't know how to do that, but if we work with the diplomatic community and we learn how to communicate things that may be informed by science, but may not be prudent when it comes to political decisions. This is the importance of these discussions. And then I think really it's really partnerships. Without partnerships, we would not be able to achieve. There are too many problems that need partnerships at different levels to be able to address this, these problems that we have. Thank you.
Thank you so much, Professor Makani. Dr. Endelea.
Thank you very much. Brenda, I think with this shrinking aid, we need to come together as local NGOs, as local, but also local international, to see what other fundraising strategies we can employ to fill the gap. But we need to be very more focused because problems are many, but how do we address each of them? We can address government interest in PPPs. However, if you look at the local government authority, the LGAs, there is a lot of internally generated resources in districts, but rarely they are put into health. Very rarely they are put into health. So I think it's important also to create awareness among ourselves as a country, looking at local LGA's budget and how best we can utilize those to fill the gap. So there is a lot of work to do, but I think in the long run, we can attain some sort of sustainability in terms of funding for programs and funding for research within the country. So from me, I would like to emphasize the issue on international global health diplomacy in terms of partnership. We really need to partner. We cannot do it alone. Thank you.
Thank you, Dr. Ntuli. 1 minute.
Thank you. I think with the changing in the global financing landscape, we need to focus on the domestic financing, universal insurance, blended financing, public-private partnership, and also trying to see how do we partner is quite very important going forward. With regard to the cross-border issues, the good thing is has already established the framework for the cross-border surveillance where we use the event-based surveillance system or community-based surveillance system. And now even the communities who are stays across the borders are aware of these tools to enable them report on time. With regard to the question which was asked by Julieta, when it comes to the public health and politics, you must know the rules and the framework of engagement. There are some of the things you as a public health officer or specialist, you are mandated to make any announcement or declarations. There are some that has to be done through consultation. So we have all these rules of the game. You must know. If you don't know them, then you are in trouble. You will face always the challenges. So for you to navigate through, you must know these frameworks, and they are key for the global health specialists and public health specialists. Otherwise, you won't be able to stay even a single year. within the government. Last but not least, just to say, we need diplomacy in all policies. Diplomacy has to be everywhere. We need universities to prepare people to engage into regional and global diplomacy. I'll stop there.
Thank you so much, Dr. Ntuli. To conclude, I would also like to respond to the Ambassador of Uganda, where he asked about benchmarking from other African countries. So I'll give a few examples that we have here at MUHAS. So we have around 40 projects around the SADC region with around 8 million USD worth of funding. And some of the examples that I can give, Prof. Makani mentioned the SQF in Africa consortia of 8 countries. We have Zambia, Zimbabwe, South Africa, Ghana, Mali, Nigeria, Uganda, and Tanzania. As well as we had a Persuade initiative, which was led by Uganda, by the School of, under the School of Public Health under Professor Roda Wanyenzi from Makerere University. And with this consortia, we had DRC, Malawi, University of Zambia, University of Zimbabwe, Witwatersrand, South Africa. And one of our, so it was a global fund project where we worked on HIV, malaria, and TB programs. So these are just some of the examples that we have currently. We also have other partnerships with University of Zambia through Zambia program, HIV Stigma program. So we have several, and we're also learning from other countries on the best practices, community of practice, and how we can actually use those examples and implement them here in Tanzania. With that, I would like to thank the panelists for their time. We've learned a lot from you. Thank you so much. And thank you for being an engaging audience. It was a very fruitful discussion, even though even though I ambushed some of you, but you still managed to respond, so thank you so much. And with that, we can go back to our seats, and I would also like to request the ambassadors in the room to step outside to welcome the minister, and then we will resume our session in the next 10 minutes. Thank you. So Helen, please. So Helen will escort you to the ministers outside. Yes.